you'll have a head pillow, and then you'll have 3 additional pillows, okay? The patient will be in a, this position, I guess. Does it say lower the bed, lower the head of the bed on your skill? Can you look in the in your booklet? You guys have your booklets?
Yep.
Okay. Look in your booklets to positions on side.
Yes.
Okay. So does say.
Before turning, lowers head of bed.
Okay, so hold on. So let me go ahead and sit this patient. I don't know. Now, this is the stupid part of this whole situation here. This patient would never be sitting up if we had to roll them to the side. If they had to go from a back to a side, you know what I mean? We don't do this to patients who can sit up. If they can sit up, that means they can probably roll to the side, so we wouldn't be doing this skill. But I'll just go ahead and put this patient up anyway. But you know what? Yeah, I will. I'll just put him up just for a minute. Okay, so there. He's kind of up like that, right? So the first step we're going to do, of course, is knock, introduce, wash hands, just like we have here. Knock, introduce, wash hands. So, good morning, Miss Jones. It's Michelle, your caregiver. Wash hands. Then you're going to come to the side of the bed. Okay? You're going to ask her, can you what? Because she's on the floor. Raise the bed so I can talk to you. And you're also raising the bed to a comfortable working level, right? You're going to pull the privacy curtain at that point, face to face. You're going to say, Miss Jones, you've been on your back for a little bit. I would like to turn you to your right side. Will that be okay? All right, so she says okay, even though she's comatose. Okay. You're going to, of course, lower your head of your bed first. She may be covered, so if she's covered, at this point, I'm not going to uncover her yet. I'm going to raise the rail on the opposite side, or the side that I'm going to roll her to. And I'm also going to, safety, lock the bed. Make sure that the bed is locked. Bed is locked, bed is locked. Okay, great. So now, this patient is here. She's away from the rail, so I can roll her comfortably. But first there's a couple of things I have to do. When I'm over there putting the rail up, I'm going to put her arm to the side, like that, okay? I'm going to put her arm to the side. Why am I doing that? So she doesn't roll over onto her arm like this. So her arm's out. When she rolls, she's going to be like that. Because remember, this is a position.
Should we put the arm like that?
Yeah, we're going to put it out. When I'm over there putting up the rail, after I put up the rail, I'm just going to reach over and just pull her arm out. I don't want to reach over, though. Don't reach over the patient. This bed is going to be out here. You'll be able to walk around the patient, okay? The next thing I'm going to do is I'm going to go head to toe. I'm going to move her head very gently, the pillow, over to the side so that when she rolls, the pillow is over there. But I'm not going to take her head off of this pillow. The next thing I'm going to do is go ahead and ask her, I'm going to cross her arm over her chest. And I'm going to cross her legs if she doesn't have any hip or pelvic injury. We cannot cross legs that have hip or pelvic injury. So obviously she's an amputee, but I'm going to just do this anyway. Okay, there. Okay, so you would kind of just, cross it like this. Okay, hopefully I can keep her like that. There. Oh, come here, you. Go. Okay, so her legs are crossed. Her arm is up, and so now I'm ready to turn her. Okay, she's in supine position at this time, of course. And I'm going to here, and I'm going to tell her, Miss Jones, on the count, when I count 1, 2, 3, on 3, I'm going to turn you over. Okay, 1, 2, 3, and we're turning her. And as we turn her, of course, we have our 3 pillows. The first pillow I'm going to tuck into her back. You can do it 2 ways. You can tuck it this way, or you can take the pillow and reverse it and tuck it this way, making a wedge. Okay, like this. Then you're going to go ahead and let her roll back onto the pillow. Now when you roll her back on the pillow, what you want to do is check that her shoulder is not on this part. This is called a bony prominence. This is where a pressure ulcer will form. We're taking her off of all of these pressure areas to keep those bony prominences
so
off
it's off
of
the
this
pillow,
mattress.
is
Yes.
what you're saying?
Well, it's the bony prominence. She's laying here on this instead of here. Now, ideally I would like for her, if you want to guys kind of come up after this, and feel on where her shoulder is, because that's where I want it. The next thing I'm going to do, of course, is take her next one, and I'm going to go ahead and I'm going to tell her, I'm going to lift your leg, Miss Jones. If you have any pain, let me know. Of course, I said that at the beginning also. And I'm going to just take her leg, and this leg is going to be straight. So you want to make sure that this is in alignment, and then this knee is going to be just slightly bent. And I'm going to make sure that she's offloaded, that her knees aren't touching, and this is slightly, this leg is going to be slightly forward, and of course in the right body position. So like that, okay? And then the third one is going to go up underneath her arm. Miss Jones, I'm going to lift your arm. If you have any pain, let me know. And that goes, again, like a little bit of crisscrossing, okay? After that, she's all set. Everything's checked. I'm looking at her body. She seems to be in alignment. She's okay. I'm going to grab the call light. I'm going to go ahead and what I would do is I would cover her up, and I would put the cover over this, underneath here again, and then I would put, of course, her call light. Can you reach it? Can you, whatever. Can you reach it? Can you press it? It's going to go in here, okay? So she can. At this point, I'm going to cover her back. I've covered her up, and of course, I'm going to lower the bed and wash my hands.
What about the railing on the other side?
Leave it.
Leave it up?
You have to leave it. Yeah.
Okay.
So she doesn't.
And so we lower the bed and
Yes,
then
lower
wash
the bed
hands?
and then wash hands, yeah.
So, okay.
End of skill.
Okay.
This one is fairly, you just have to learn,